I'm here for the World Medical Innovation Forum, which has been a wonderful experience. My name's Robbert Kingston. I'm the Chief Academic Officer and Senior Vice President for Research at Mass General, and I'm a professor of genetics at Harvard Medical School.
Hi, I'm Dr. Kathryn Rexrode, the Chief Academic Officer at the Brigham and a physician scientist, and it was incredible to be here to witness the exciting innovation and discoveries that are going on.
So one thing that I was very, very struck by in the presentations we heard today was just how much what used to be very basic science has changed clinical care. I'm old. I grew up during the time when sequencing DNA was something you did on little small pieces. And the fact that you can take a blood sample from a mother and sequence the entire fetal genome of the child that she is carrying is mind-boggling. And the fact that that is something that can be potentially moved to broad usage throughout the world is just stunning over the past years. And it's an example of something that is very near and dear to me as a PhD scientist who works on nucleic acids. It's something that was a basic discovery in nucleic acid biochemistry is now going to transform how we handle kids being born.
I agree. That was tremendously exciting. And I think the other thing the forum highlights is that clinical translational piece, as you say, coming from basic science to new diagnostics. There were really exciting new therapeutics as well. And as a clinician, women's health provider, Jeannie Lee's reactivation of the inactivated X just shows the power of digging more deeply into thinking about biology and sex differences and really exciting work.
You know, somebody in the last session was talking about how you can't go more than 20 minutes without saying AI, but I'm going to say AI. The other thing is the ways that artificial intelligence can do various things that are remarkable. Face recognition, story where you're looking at how old somebody's face looks can have a significant impact not only on devising their treatment but also in helping them understand and helping doctors understand just how biologically old, how not biologically, clinically old, yeah, they are.
I would say the other, there were a number of AI presentations that were exciting. As an educator, the patient simulated large language model simulations, I think, have the power to really improve the quality of our teaching and do that in a way that's really revolutionary. And also the clinical trials AI support to speed the therapies we're trying to study to market was really exciting. The one thing I would say about AI that has always been a concern of mine is that it's using the data we have, which is not necessarily representative of the populations we want to serve. So there are many examples, as we know, about AI, perhaps facial recognition not being trained on different colors of skin. Again, as somebody who thinks about women's health, often our data has not been disaggregated by sex in ways that can really be used in these AI models. So I think we have to think carefully about the data sets we're using to train AI, and then think about, what do we need to bring in so that we can have truly representative modeling.
And the third thing I'll say about AI is that there was a presentation, first of all, by somebody who's still an MD PhD student and is already getting involved in commercializing an AI application, which is being used to help train medical students. And I happen to have a daughter who's was a medical student. She's now a resident, but that is the sort of thing that would have been incredibly helpful for her in learning how to interface with patients and learning also what sorts of questions lead to diagnoses, et cetera.
I think we saw so many breakthrough discoveries, as you say, things that we might not have thought even possible a few years ago. But I think it also presages the future, where there's so many exciting advances. So we certainly saw a number of examples of gene and cell therapy advancing new treatments. There were several new diagnostics that will really reduce the barriers to being able to diagnose, and as I think was mentioned in the big ideas panel, diagnose even earlier so that we can stop a disease before it's actually caused the destruction. That would be game changing. So we have new therapies. If we can push back the clock of when we make that diagnosis, then the brain damage hasn't been done, the joint damage hasn't been done. I think that's really exciting for the future.
I wanted to go to the bigger, sort of more like 40 or 50,000 foot level here. One thing that I love about working at MGB is the number of truly creative people doing very, very, very different types of work from each other and appreciating the different types of work that the others are doing and getting together and combining people who take different viewpoints on a problem. When I started at Mass General 40 years ago, we used to talk about how we never talked with each other about what we were doing. We all said hello to each other in the hallways, but we didn't really talk about what we could do together, what we could do. And now that is the norm. The norm is that everybody wants to know what the other person is doing, and everybody thinks about whether or not there's somebody else in the community that they can get together with and synergize with and really drive something forward. It's a change in the approach, and it is something that's wonderful about MGB is there's so many talented people that there's a great partner for you out there somewhere.
Right, it's that matchmaking that we need to do. The World Innovation Forum, World Medical Innovation Forum, is also really demonstrates the need for bringing together academics, industry leaders, and venture capitalists, because to take that discovery all the way to the patient really needs a partnership. And so, having a forum to be able to showcase some of those new discoveries, to form new relationships, to really achieve the goals we want, which is really to transform health. So we are making groundbreaking discoveries, and we're often able to take them several steps forward in, the process. But we need this partnership with industry, with venture capital, to really deliver on, that hope for the future.
Yep. I don't have anything more to say. I do want to say on the matchmaking part of the thing that I did meet my wife at Mass General, so that worked out.
The 2025 World Medical Innovation Forum has been tremendously exciting, and we are very much looking forward to the new innovations that we'll be talking about next year, 2026.